This demonstration is intended as a resource for previous students and licensed clinicians who can perform dry needling in their practice act and jurisdiction. Please do not attempt dry needling without proper licensure and training. For the neck pain treatment protocol, the precautions to consider are spinal cord injury, arterial injury, dural puncture, dorsal root injury, the lung fields, and the subclavian artery and vein. For this particular treatment setup, you'll insert 6 needles. The first 4 needles will be inserted into the cervical multifidi with needle sizes ranging from 30 to 40 millimeters. The second needle will be inserted into the upper trapezius with needle sizes ranging from 30 to 50 millimeters. And the last needle will be inserted into the levator scapulae with needle sizes ranging from 30 to 40 millimeters.
So to mark the scapula, we're just going to mark the medial border, and we're going to mark the spine of the scapula. Now remember where the spine meets the medial border, that's not the top of the scapula. So it continues up to the superior medial point, then that comes down and forms your supraspinous fossa. So levator is going to be coming off the superior medial scapular border, and it's going up to the transverse process. Posterior tubercles are the transverse processes of C1 to C4. So that's going to be levator. And then upper trap, we're just going to pinch it. We'll get it right there. So it's going to be upper trap. Now, for the cervical paravertebrals, we're going to find the spinous process, and we're going to find the edge of the spinous process. We'll mark the edge of the spinous process. Then we're going to mark 1 finger width out from the edge of the spinous process using the patient's finger width, not yours.
After those markings are complete, you'll perform the same markings on the opposite side of the neck. As always, you'll maintain a clean technique by using gloves and performing an alcohol wipe down to all of the areas that you're going to insert a needle.
So I'm going to go ahead and hit that C2. So I'm going to leave my finger on the edge of the spinous process. 1 finger width out from the edge of the spinous process. We'll tap this in, little tap. If this is vertical, here's my slightly medial. And there's her lamina. She's nice and little.
Makes me shake every time.
Come down to a little bit lower segment. So again, fingers on the edge of the spinous process, little tap. This is vertical. Here's my slightly medial. A little grosser tissue there. You okay?
Mm-hmm.
There's your lamina right there too. Fingers on the edge of the spinous process, little tap. This is vertical, slightly medial. There's your lamina there. Still fingers on the edge of the spinous process, finger width out, little tap. This is vertical, slightly medial. Lamina there too. Superior medial scapular border, so you can either pinch or you can do this depressing technique. So a little tap. Having a needle around other needles. That's part of the fun. You okay there?
Mm-hmm.
And let's do upper trap. So don't grab super aggressively because you already got a needle here. So a little tap here. Just needle this tissue in between my fingers. Ooh, nice twitch.
Hey.
Mm-hmm.
See all those twitches?
To set up the leads for electrical stimulation, you'll do 1 channel on one side of her cervical paravertebrals. So in this picture, you see the blue wires as a black and a red on the right side of her neck. And then you'll set up the second channel on the left side of the cervical paravertebrals. So as you see, the red wire has a black and a red on the left side of her neck. And then the last channel, which is the yellow wires in this image, will attach to the levator and the upper trap. For this treatment setup, we typically run the electrical stimulation for 10 to 15 minutes with the intensity set to the patient's tolerance.